On this week VA News, we have these stories.
VA medical technology advances attracted a lot of attention at the National Press Club recently.
The post 9/11 GI Bill is 4 years old.
And a look at another Tillman Foundation scholar.
I'm Andrea Garner with the VA Learning University.
And I'm Sean Rogers from Plant City, Florida and the U.S. Military Academy, interning this summer with the Office of Public Affairs. We're coming right back, so stay with us.
VA recently put its best technology on display to show how it has expanded access to VA healthcare for veterans across the nation, some in the most remote locations. VA Undersecretary for Health Dr. Robert Petzold and Senate Veterans Affairs Chairman Bernie Sanders headlined the Connected Health Showcase at the National Press Club to show how these new tools are helping exceed goals previously set.
The Department of Veterans Affairs, representing 151 medical centers, was recently named to the 2013 Most Wired Hospitals list.
Last week, VA received a 2013 Most Wired Award. This award is given by Hospitals and Healthcare Networks magazine and recognizes health systems that are leveraging health information technology in new and innovative ways. While some of our individual medical centers have been recognized in the past, this is the first time that our entire system has been honored with this award.
The Connected Health Showcase provided insight into how the application of these new information technologies is transforming VA's delivery of health care.
We're moving to a delivery model that, with technologies, not only puts veterans in the center of their care, but empowers them to actually drive their care. We're going beyond simply treating problems and diseases. We're treating the whole person. And we're forming lifelong partnerships with patients that optimizes their health care and their well-being.
Vermont Senator Bernard Sanders, chairman of the Senate Veterans Affairs Committee, joined VA Undersecretary for Health Dr. Robert Petzold in highlighting how VA is connecting health care and information technology.
It significantly improves access to health care. It brings health care, in many cases, right to the home of a patient. This is important nationally. It is especially important in rural America, in states like Vermont, where our patients live a long distance away from a medical center. So the idea that you can be at home and now have contact with high-quality medical providers is an extraordinary breakthrough, and I thank the VA for doing the work they're doing in that area.
Secure telecommunications technology at the VA Medical Center in White River Junction, Vermont, was one of the innovative programs featured in an exhibit at the National Press Club.
Make it easier for them to adhere to appointment schedules, especially because we try very much to accommodate their schedules around the tele, and the tele makes it easier for us to do that.
The home telehealth technology uses a computer link to connect doctors and other healthcare providers with veterans in their homes.
As a rural veteran myself, it's a game changer because it allows you to get the care at the time, place, and location that you prefer it. And so what this is doing, it's allowing us to expand the number of veterans that can access their care in new and innovative ways.
There are other places that are doing some of this or some of that. The VA is the only place I know where we brought all of this stuff together and have a coherent strategy of moving forward with Connected Health.
August 3rd marked the 4th anniversary of this event at George Mason University in Fairfax, Virginia, where President Obama, Vice President Biden, and Secretary Shinseki announced the implementation of the post-9/11 GI Bill. Since 2009, the landmark legislation has made it possible for VA to issue approximately $30 billion in education benefit payments to nearly 1 million service members, veterans, and family members. The post-9/11 bill is the most extensive education assistance program since the Servicemen's Readjustment Act of 1944. The original GI Bill was for returning World War II service members. A few new tools are being launched by VA this summer to help GI Bill beneficiaries learn more about their vocational aptitudes and select an educational institution. They include the guide called Factors to Consider When Choosing a School that offers future students steps to take when researching, choosing, and attending a school. CareerScope. That's a free, new tool that measures a student's aptitude and interest through an online test they administer. It also identifies potential career paths. And the GI Bill Comparison Tool. That allows students to research and compare schools. It provides clear indicators like average student loan debt and graduation rates. Information on these tools and more on the post-9/11 GI Bill and other veteran education programs is available on the web address on the screen.
We have another Pat Tillman Foundation scholar to introduce to you. Lindsay Anderson was one of the first scholars at the Tillman Foundation. She attended the Leadership Summit in Chicago last month.
Anderson, an Army veteran from Iowa, now in college in New York, talked with Jay Rosenfelder, who was in Chicago to cover this annual Leadership Summit.
So a few months back, I was giving a tour for a woman who had Alzheimer's and her daughter, and they were frequent visitors to the museum. They had left for the tour, and I received a phone call a few months later that unfortunately she had passed away, the mother. However, she reiterated to me that the last few months of her life, of her mother's life, were made memorable by our program. And I feel like, again, it's just those little moments where you can touch a human life that continue to inspire me. So my name is Lindsay Anderson. I was in the Iowa Army National Guard. During my deployment to Iraq, I really learned a lot about compassion for others, and I realized how necessary it is to embrace the experience that you're given, whatever your fate may be. And I think that's something that's definitely stuck by me, and realizing that, you know, we're all on different tracks in life, but being able to use like those ripples in the waves, or those things that seem like obstacles to help you overcome. When I was over there, it wasn't all great experiences, but I think that just speaks to the power of resiliency of the human nature, and the fact that even though we can endure these really difficult situations that seem irrevocably difficult, that we all do really have the ability to overcome in time. And oftentimes it's time and telling your story and finding a passion. And during my downtime, which is kind of few and far between, but there is definitely downtime, rather than playing video games or reading even, I was really exploring the post. So I was picking up objects of cultural significance, be it a AK-47 bayonet, an image of Saddam, an old training aid, a map, and I collected them. I took them home, and I ended up donating many objects to the Iowa Gold Star Military Museum. And again, this started my quest and desire to keep cultural heritage, to study it, to question its history, and hopefully display it for others to understand the person behind the stories that we hear, like read in our textbooks, but to kind of have some tangible objects left behind. What I hope to offer is the opportunity for other scholars and veterans to see that service can mean a lot of things. You don't have to just go into law or policy or economics or environment to make some major change, and that art and music and other routes can also help communities.
The 7th graduation class from the National Cemetery Director Intern Program received their completion certificates in a ceremony at VA Central Office July 26. The 10 newest graduates completed a full year of training at the National Cemetery Academy at the Jefferson Barracks National Cemetery in St. Louis.
The program is our succession planning for the new cemeteries we have, and to replace directors that are retiring, to ensure that our new directors have everything they need to be able to lead their facilities and continue the high customer service that NCA has.
In the beginning, as a veteran, I didn't know much about the cemetery administration and all the intricate details, but the course taught us from the budgetary and administrative side to the operational side, brought it all together for me, and now have a clear understanding of the cemetery operation, and I can relate that to the veterans and their families.
Here are the graduates receiving their certificates and where they're going to practice their newly acquired skills.
Dr. Harry Marshall, an Iraq War veteran, Chief Medical Officer for the Washington, D.C. National Guard, and now a VA surgeon, is the subject of the August-September edition of Still Serving. The show is about men and women who serve their country, fellow citizens, and their brothers and sisters in arms, still serving their fellow veterans. Here's a clip from the show.
I love what I do.
An Iraq War veteran to VA surgeon, Dr. Harry Marshall is living his dream, serving our veterans.
If a patient wants a good surgeon, I want to be that good surgeon. Now, although I know if I can have a bigger impact in terms of systems improvement here at the VA, service delivery here at the VA, of course, I'd love to jump at that chance.
Commissioned in 1980, Dr. Marshall is still serving as an accomplished critical care and trauma surgeon and decorated combat veteran.
But I came here, one, because I wanted to, and the training, my training, we did rotations here at the VA Medical Center. So having the active duty experience and the reserve experience, and seeing the soldiers, I thought there'd be no better job to kind of top off my career.
Did you know? Last month, the Obama administration kicked off its 5th annual Securing Americans' Value and Efficiency, or SAVE, award competition. The SAVE campaign was born out of the president's belief that the best ideas come from those on the front lines. Over the 5-year period, more than 85,000 ideas have been submitted, including 80 that have saved hundreds of millions of dollars. Nancy Fitchner, a VA employee in Colorado, was the very first grand prize winner in 2009 with a proposal to end the waste of medicine by giving unused portions to patients when they leave the hospital.
He's asking each and every one of us and said, just send it on up the line, and I did. It still surprises me. I mean, it's just an idea. You know, we all have ideas.
The submission period has closed, but there's always next year. And you can follow the program at the White House web address on the screen. That's all we have for this show. Thanks for tuning in today. I'm Andrea Garner.
And I'm Sean Rogers. Have a great day and rest of your week.